which is a lupus walk. Of course, I heard so many walks on the ramp, but it's an unusual thing to be done. And what little I know about lupus is way back when I was an anesthesiologist, a budding anesthesiologist in Gandhi. There was a lady who came with a lot of bleeding and they had to do a cesarean section, and she was a known case of lupus. So you can imagine in those days, and I had a tremendous amount of difficulty treating her, giving her anesthesia, putting her on ventilator. And in Gandhi in those days, the gynec used to be separate and the main hospital used to be separate. So I had to take her to the ICU, which we used to have for the cardiac patients. So somehow we managed. And the next day I got a little bit of scolding from the gynecologist. Then she said, "Why did you do this? Why did you take the patient?" I said, "I don't have to answer you because I only did that to save a life." I was a little bit kinky even from those days. So I'm just telling that that is how it used to be. It's such a tremendous amount of stress for the treating doctor, for the patient. Now over a period of time, people have realized, and I know maybe sometimes I wonder, being a woman, I think it is given to women because they tolerate a lot of things much better. They can stand up and they can move forward. This is what I always felt. Because lupus coming 90% in women, so how they are managing is a tremendous amount of effort from the person who suffers. We can tell all this, but the person who has lupus will be having ups and downs, but they are so good now. They understand the disease in depth. They know that they can eat maybe cranberries, berries and things like that because they have got more antioxidants. Then you can eat kale and spinach or something like that so that it is better for you. So like that, now you have read so many things about it, so you control, and you don't like to go, sun is your enemy in lupus. So these are all the things, as a woman, you tend to understand, and you are cooking, so you can do these things better for yourself. Of course, women cook for everyone. Usually they don't bother about them, but it is your life, and you have to bother about yourself. And you take care of others. I'm not saying because we are born to take care, and to take care of us also. It is very important. So if you really have a strong will, you can cross any destiny, okay? So as he said, they used to be so worried about breast cancer. So I don't have a problem. I had it too, but I am just gone ahead and don't look back for it at all. So many of them don't know about it. But I'm just saying, so if you really take into yourself that you want to do it well, whatever disease you can conquer, and you should have a right doctor. And so I see that you all think a lot about Dr. Sharath. He has always has been a very hardworking. And coupled with him, Dr. Srinivas is sitting with us. So all three of us are from NIMS. So I was just telling them that when I came to here, I never felt I came back to NIMS again. Okay. So I wish you all the best and have a good day and a good ramp walk. Don't feel afraid. Go ahead, surge forward. Thank you very much.